Chapter 26, Growth and Development of the Toddler. Learning objectives, we're going to talk about some physiologic, psychosocial, cognitive changes in the toddler, identify some fine and motor, gross motor milestones. We're talking about language, sensory development. We're going to talk about emotional, developmental, moral, spiritual development. We're going to discuss toddlers' need for sleep, rest, dental care. We're going to discuss nutritional requirements. We're going to talk about anticipatory guidance, which we mentioned in the last chapter. We're going to talk a little bit about discipline. And then we're going to talk about the role of the parent in the toddlerhood. There is your Pima outcomes. Okay, so we talked about the infant is birth to 1 year. Now we're the toddler, so 1 to 3 years. You know, in the infant, they have a lot of growth and development in that first year. And so in the toddler, in toddlerhood, the height and weight increases slowly in spurts, but much slower than in the infant. The fontanelles, so you'll learn about fontanelles in OB, but those are the openings in the skull, will close by about 18 months, and then the head is more proportional to the body by the time they reach age 3. We're going to talk a little bit about organ system development. So their brain reaches about 90% of the size by age 2. By age 3, it's more closer to the adult size, and the head growth slows, and we no longer measure head circumference after the age of 3 because it's the same. It shouldn't grow anymore, but we do measure head circumference as part of the vital signs. Respiratory system, so their alveoli increase, and one thing to remember, and we'll talk more about this in the respiratory chapter, is that the trachea and airways are small compared to the adult. So smaller airways, more problems with congestion, things like that. When an infant is born, their heart rate is high, blood pressure is low, and that changes throughout childhood. When they're a baby, they have a very small stomach capacity, and so in toddlerhood that grows. Bladder, adult function by about 16 to 24 months, but short urethra, which leads more to urinary tract infections. And then musculoskeletal system, so those bones start to increase in length. They do have sway back, pot belly because of the weak muscles until about 3 years old. So sometimes when they start walking, they have like flat feet, maybe bowed legs, and then the pot belly. But that all should disappear by about 3. Okay, so theories. We talked a little bit about some theories in the infant chapter. We're still in the sensory-motor stage for Piaget up until about 2. We've all heard of Freud and his anal stage. And then Erickson is the one that we are concerned about. So for Erickson's stages, the psychosocial stage is that autonomy versus shame and doubt. And then the Kohlberg's is the moral factor. So autonomy versus shame and doubt. This is the age where they are trying to do things themselves. They say the word no all the time, so a lot of negativism. They will imitate adults sometimes, and then they really need that building up of self-esteem, and teaching about right and wrong, things like that. I like this little saying: a child's play is not simply a reproduction of what he's experienced, but creative reworking of the impressions he has acquired. So it's not just playing with a toy, it's all the other things that are going on with learning. So we're going to go talk about gross motor skills and fine motor skills. So again, They walk around a year, and so now they start running, climbing, pushing, pulling, bikes. They start doing more fine motor skills, crayon coloring, things like that. You As you can see, the more skills they can do, the more areas for injury. Language. So receptive is they can understand what's being said, and they really develop that skill before they just develop the expressive skill. So even when you think they're not understanding, when you don't want them to listen to you, they're listening and understanding. They have what's called echolalia, which is repeated of words and phrases without understanding them. Telegraphic speech, sorry, my picture's covering it, but that is, they're only going to tell you the words you need to know. It's kind of like texting. When you text, you don't go into a whole big story. Well, some people don't. Telegraphic speech is just the words to get to the point. So you'll see more of that in the toddler. Emotional development toddlers, they're starting to see themselves separate from the parent. The separation anxiety they experienced in infancy manifests sometimes in the toddler area, but it's not as significant. They are leading more of a sense of self. That egocentrism. So anybody who has a toddler knows that it's all about them. And so that can be challenging at times. A separation anxiety, about 18 to 24 months. Temper tantrums, I put a little picture here of a temper tantrum. And their fears are loss and loud noises. So when we talk about temper tantrums in toddlers, the reason they have temper tantrums is because they can't get their point across. They don't have the emotional and verbal ability to get their point across. And so sometimes it is because they're tired, they're hungry, they're overwhelmed. Sometimes there's no rhyme or reason. I saw my granddaughter have a meltdown at 2 because her socks were pink. Sometimes it doesn't really matter. I'm sure you all have some examples if you have kids of what sets off a toddler. It's the best thing to do is just to leave them if they're in a safe place, and trying to pick them up, trying to get them to stop is not always going to work, but very frustrating to parents. So what's our role? Our role is to understand growth and development, understand some of those milestones, some of those motor abilities, and when we can understand how they're developing these skills to run and climb and everything, that leads right into anticipatory guidance. So bicycle helmets, gun locks, all those things, especially some type of pool gate, even a top lock on a sliding glass door. Kids are drawn to water, so they're this age group especially. Doesn't matter if they've had swimming lessons or not, kids can drown even if they've had them. So that guidance, look, they're going to be climbing on things, they're going to be getting into cabinets. Maybe you moved your medication to a higher shelf. Well, they're going to be able to climb on that. So really need to baby-proof, toddler-proof. Identifying problems, so developmental delays. Children have well checks, or suggested children have well checks at their pediatrician's office, and they will do some screenings to, just see where the toddler is, what they're doing, what kind of milestones are they meeting them, and at any time that they identify a problem, they can treat that at a younger age, and that has a better outcome. So growth and development, we've talked about that. So promoting that healthy growth and development, building the self-esteem. And what's really important to this age group are routines and rituals. So even though they don't like routines and rituals, and they don't like going to bed at a certain time at night, things like that, they do better with that. And I noticed sometimes with my kids, they, they fought you, but they do better. And then you go on vacation, or it's summertime, or homeschooling, and then routines sometimes go away, and then they're harder to get back to when you need to. Play. So we've talked a lot about play. That's a major socializing medium for toddlers. This is a hot spot for them. They'll do more of the parallel play. So we talked about solitary play. Now we're into parallel play. And usually that's, it's recommended they have about 30 minutes of structured physical activity a day. And then they can have 1 to 3 of unstructured. So structured would be, somebody guiding their physical activity. Let's go for a walk. Let's go for a bike ride, something like that. And then 1 to 3 hours, just let them be kids, run around the yard, run around the playground, things like that. The American Academy of Pediatrics is really big on limiting television screen time and encouraging more creative and physical play. But we all know at times it's screen time is helpful when you're trying to study for a test or be in a class or things like that. So there are times that it's appropriate. They're egocentric, so it's all about me. They don't like to share. Very short attention span. It's really hard with a toddler when you are telling them something. If you tell the toddler we're going to Disneyland next week, that they don't know what next week is. They have no comprehension of that. So they will be asking you every day if today is next week. You tell them when you pull up to Disneyland and there's Mickey, you're going to Disneyland. Same thing with when we take care of a toddler. We don't go in there and explain, I'm going to come in, I'm going to put a needle in your arm, you're going to get a little pick. This is what we're going to do. And then we come back an hour later. They don't know, they don't remember. So with them, you have to do that education right there in their language and do the procedure. And then age-appropriate toys. This is obviously not one. Car safety. Sorry, my Tide Pod is in the middle of the screen. But car safety. So rear facing up to 4. We talked a little bit about car seat rear facing in the infant chapter. And the American Academy of Pediatrics just last year said up to 4, as long as they don't go over the weight for the car seat. And so remember, their legs bend up. They can fold their legs up. And that's better than any type of spine or head injury. Poisoning, securing cleaning supplies, things like that. Tide Pods are a big one. They look like candy, so kids get into them. Having cabinet locks is important. One of in my experience, I've seen some kids with Tide Pods where they squeeze them so hard they pop, and it got in the one little girl's eye. She lost vision in that eye because there's bleach in there. Another kid whose parents put some degreaser in a Gatorade bottle because the other bottle broke or something, and then it looked like yellow Gatorade, and the child drank it, and it had burns all down their esophagus. Kids get pills. If you drop a pill, they'll find it. Anything they can get into, they will. So it's really important for teaching safety. And then water, drowning. And they can drown in 2 inches of water, like I told you before, a mop bucket, a dog dish, the toilet, things like that. It doesn't take much for them to drown. Food. So with the toddler, they have what's called physiologic anorexia. So sometimes they don't want to eat, or they only want to eat the same thing. Chicken nuggets is a big one. That's why I put a picture of it. They should have high nutrient foods. If they're on a vegan diet, if the parents are vegan, then there could be issues with nutrients. So it just needs to be monitored by the physician. It is possible, it just needs to be monitored. Weaning, they should be weaning from the bottle and breast in toddlerhood. Usually they say bottle by a year. Some people breastfeed up into 2-3 years. Solid foods, so choking hazards. One of the biggest ones are grapes. And so grapes are kind of just the same size as their airway. So you want to cut those in half and then half again. Hot dogs is the size of an airway. Hard candies, things like that. It's important to keep them out of reach. And so they also have the food jags. So they want to eat the same thing every day. And that happens a lot with toddlers. You also don't want to give a toddler a choice of what do you want to eat. You want to give them a choice of do you want this or that, because otherwise you'll be there all day. Same with getting dressed, same with things like that. Give them structured choices. And then we see obesity. So kids who are obese, the younger they are, even if they outgrow that obesity as an adult, they still may have the same health problems. So we're going to talk a little bit about growth charts in our class tomorrow. Sleep, you need a lot of sleep. I put this chart up there so you can see where you are on the sleep scale. I know nursing students don't sleep too much, so you may be even lower than the recommended, but they need a lot of sleep. So anywhere from 12 to 13 hours, basically. One of the HP 2020 rules is recommendations is that all children have access to health care, and that dental care is taken very seriously, preventing cavities, allowing for dental care. And so every child should have access to that. When we talk about spanking guidance, we don't really want to tell the parents how to raise their children, just like we wouldn't want to be told how to raise our children. But we do want to think about, if they're abusing them, spanking them, and just some guidance in that area. I talked about weaning, so weaning from the bottle and getting into solid foods. We also talk about weaning into toilet training weaning. So they don't have spinal cord myelinization until about 2 years old. So until then, they don't have that control over their sphincters until at least then. So if you try to teach the toilet training prior to that, then it may not work. So you might be just training yourself to take him to the bathroom when it's time to go. Some signs of readiness are there. So they have to want to be potty trained. They want to be able to undress themselves. They need to really be bothered that their diaper is wet or dirty. So negativism, so that no word is very common in this period. So they have that sense of autonomy, and parents need to really be aware of this negativism, and maybe not asking them yes and no questions, because you'll probably always get a no. Giving them simple choices that I told you about. One of the examples in the book is, do you want to use the red cup or do you want to use the blue cup? Because if you say, do you want to use the red cup, they're going to say no. So giving them those choices where they have to make a decision one way or the other will help. Temper tantrums, I talked a little bit about that, how they can't express what's going on. I was at Disneyland one time. It was 10 o'clock at night, so you have to stay up for the light parade. There were so many toddlers having temper tantrums because I believe they were probably they were overtired, they were overstressed, overstimulated, and so sometimes that is the case. Thumb suckings and pacifiers, they should try to wean them before the teeth erupt. You can see a picture of a child who had a pacifier and how it has affected the teeth growth. It also affects their speech. So if they have a pacifier in constantly, that could be causing problems with their speech, and they may not be as advanced as they should. Regression. So some toddlers experience regression in stressful times. So when a new baby comes home, that's always a stressful time. When parents are going through maybe a divorce or fighting a lot, somebody's sick in the family, things like that, they may regress. If there's a child in the family that has like a chronic illness, and so they're constantly getting all the attention, the sibling may act out. And maybe will regress where they want to wear the diaper like the baby's wearing the diaper. When they act out because of sibling rivalry, is that any attention is better than none. So negative is better than no attention. So sometimes you do see that. So making sure that they are included in things. When I would go in a room to see a child, and if there was another child in the room, I would always take stickers for both of them. If you're bringing a popsicle or otter pop into one kid, grab one for the other kids if it's okay with the parents, so they feel involved. One of the benefits of working in a pediatric hospital is they have child life specialists, which child life specialists we'll talk about, but they help normalize the hospital experience for kids. And so they will, if they bring a toy or something in for the patient, they'll always include the siblings too. So that's important. So again, how do you minimize it is to the toddler's routines, individual time with the toddlers and the other patients, and involve the toddler in the care of the baby. So it's always good to prepare the children for a baby coming, and get them involved, maybe their doll, and show them how to change a diaper and things like that. The more involved they are, sometimes the issues will decrease. Okay,